are doing an ankle taping procedure. The supplies that you will need for the ankle taping procedure are 1.5 to 2 inch adhesive tape, heel and lace pads, pre-wrap, and adhesive to make sure that the tape sticks, as well as scissors to cut any of the tape that you need to. In the pre-taping procedure, you're going to want to apply heel and lace pads at the high friction areas, one at the distal aspect of the Achilles tendon and the other at the dorsal aspect of the ankle joint. Both of these are going to have skin lube on them to help hold them to the foot. Apply some pre-wrap to secure the 2 heel and lace pads in place, as well as reduce the skin irritation. Now we will apply an adhesive tape anchor strip around the lower leg at approximately the musculotendon junction of the gastrocnemius. Since the leg at this side is not cylindrically shaped, the tape must be angled slightly. This slight angling allows the tape to conform smoothly to the shape of the leg. An additional anchor will be applied at the instep or midfoot. And remember that excessive tension on the 5th metatarsal could cause pain on weight bearing. Application of the first set of stirrups is performed. Beginning on the medial aspect of the upper anchor, this stirrup continues down the inside of the leg over the medial malleolus, across the plantar aspect of the foot, over the lateral malleolus, and up the lateral aspect of the leg, and ends at the lateral aspect of the upper anchor. Proper tension must be applied to cause some eversion of the foot, thus helping to reduce inversion. And you want to apply at least 3 strips. Following the application of the stirrups, you can apply some cylindrical anchor tape to make sure that the stirrups stay in place and are secure. Following the placement of the cylindrical anchor tape, you are going to apply what we call horseshoe strips. And these will be placed first on the first horizontal strip is started on the medial aspect of the foot and continues toward the heel and below the medial malleolus, crosses the Achilles tendon below the lateral malleolus, and ends on the lateral aspect of the foot. If using the midfoot anchor, begin and end this strip on that anchor. The first heel lock strip is applied. Begin on the anterior portion of the upper anchor. This lateral heel lock will continue down the outside of the leg, crossing the Achilles tendon around the lateral aspect of the heel, angling underneath the foot, moving up the medial aspect of the leg, and ending at the anterior portion of the upper anchor. Proper tension must be applied to ensure stabilization of the calcaneus. The second heel lock strip is applied. Begin on the anterior portion of the upper anchor. This lateral heel lock will continue down the inside of the leg, crossing the Achilles tendon around the medial aspect of the heel, angling underneath the foot, moving up the medial aspect of the leg, and ending at the anterior portion of the upper anchor. Again, proper tension must be applied to ensure stabilization of the calcaneus. Repeat number 6 and 7 for additional support. A figure 8 is applied next. Starting on the dorsal aspect of the foot, move medially down the inside of the foot, across the plantar portion, up the outside of the foot to the starting point. Continuation of the tape will proceed medially around the lower leg, crossing the Achilles tendon, and finishing at the origin of this figure 8 technique. By encircling the foot and lower leg, this technique will assist in dorsal flexion and eversion. Finally, closure strips are applied. Begin proximally and work distally from the upper anchor, applying individual circular strips around the extremity to cover the tape ends. Make sure you overlap the tape approximately 1/2 its width on each strip.